I'm Alexander Fanaroff. I'm a cardiologist at the University of Pennsylvania in Philadelphia, Pennsylvania. So we know that physical activity and exercise is hugely important for improving cardiovascular and sort of general outcomes. It reduces all-cause mortality, reduces cardiovascular mortality, reduces myocardial infarction, stroke, diabetes, hypertension, hyperlipidemia. We also know that most people around the world, and especially Americans, don't get enough physical activity. And that's especially true for people that are older and at higher risk of cardiovascular events. So a number of studies have shown that interventions involving gamification and financial incentives can increase physical activity over shorter term follow-up. But what we wanted to understand in this study is, does it help over longer term follow-up? If the interventions are longer, 12 months in duration, 6 months in follow-up, can we increase physical activity for that longer duration? That's why we did the study. So the interventions are all based in behavioral economic theory. And behavioral economics is a field of study that uses concepts from economics and psychology to better understand how and why individuals make the decisions that they do, and to design interventions that take advantage of any cognitive bias people have to help them make better decisions. So the general idea is that instead of sort of being rational actors like economics sort of assumes people are, where they maximize their future benefits, people are actually have bounded rationality, which is the idea that we make too many decisions every day to actually make optimal decisions for every one of them. And we use what are called heuristics or rules of thumb to make decisions. And some of these are the idea of prospect theory, which is the idea that we value things that we have more than things that we might seek to gain. Immediacy, which is the idea that we value things in the near future more than things far out of the future. And goal gradients, which is that we try harder when our goal is within reach. So these are the concepts that we use to design the interventions in our study. So this is a randomized controlled trial of gamification versus financial incentives versus the combination of gamification versus financial incentives versus attention control. So we identified people that were high risk for major adverse cardiovascular events. So either an ASCVD risk of greater than 7.5% by the pooled cohort equation, or existing ASCVD. And we identified them via EHR algorithms, and we sent them emails or text messages inviting them to participate in the study. They then went on to the study. The email had a link to the study website where they went in to, where they could register for the study, complete informed consent, complete baseline questionnaires. After they did that, we sent everybody a Fitbit device, which they wore for 2 weeks to establish baseline measures of physical activity and baseline measures of physical activity. At that point, they were then asked to set a goal to increase their steps by 33 to 50% above baseline. And once they did that, they were randomized to one of the four arms. The interventions went on for 12 months, after which everybody had a 6-month follow-up period. And the primary outcome was the change from baseline and daily steps compared with control over the 12-month intervention period. All of the interventions had an increase in step count. So even in the control arm, we had an increase by about 1,400 steps per day from baseline. And you see a very quick increase right after the goal setting period, and then a slow decline. The intervention arms, gamification and financial incentives, both increased mean and daily step count by about 500 steps per day more than the control arm. So people were up to about 1,900 steps per day more than they were taking at baseline in the gamification and financial incentives arms. In the combination arm, where people got both gamification and financial incentives, they increased step count by about 850 steps per day more than the control conditions. So they were up at about 2,300 steps more per day than they were taking at baseline. So big increases in physical activity, both from baseline as well as beyond sort of the control condition. The take-home message for practice is that, in my opinion, and not being an expert in sort of the messaging around physical activity, I've seen it's a little bit muddled, and I think that affects patients. The CDC guidelines are actually pretty clear that people should be walking more and sitting less, but I think that there's a lot in sort of the media about taking 10,000 steps per day, and I think that it's hard for patients to sort of track that. But I think that our control group had an increase in physical activity by a substantial amount, and that's something that physicians can do with their patients. Ask them to track their steps, either with a wearable fitness tracker or just on their phone. Tell them to set a goal to increase it by a modest amount. 33 to 50% is what we use in our study, which I think is reasonable. And then tell them that you're going to check up on them, because I think that's sort of the big intervention. The biggest part of the intervention is that they knew that somebody was watching and cared. So, I think that's the intervention that you can take home tomorrow and start doing with your patients. I think on a broader level, on a health system level, the gamification and financial incentives interventions worked even above and beyond that. And as we move into, capitated models and pay-for-performance and the idea of covered lives, I think that health systems and insurers, should think about implementing some of these interventions, which are automated and simple to deliver, and can really help people increase physical activity by a large amount. We know that physical activity improves outcomes. We know that these interventions increase physical activity. What we don't know, because the data on physical activity outcomes is observational, we don't know if you enroll people in a program like this and you increase their physical activity by a substantial amount, will you reduce their cardiovascular events? And I think that's the next question. Can we do even longer term studies? Can we enroll even more patients in these studies to really understand if I give you an intervention that will increase your physical activity, will I reduce your risk of cardiovascular events? And I think that's the next question, and that's probably the big question that I'd like to answer next.